Before we hop into this video, I wanted to let you guys know that I got a new camera. So this will be the last time you guys are going to see me with almost flawless looking skin. You'll be seeing my skin in high quality detail. It's not going to be pretty. As you may have seen in my 0.75 video, the footage isn't always clear, something that's really blurry, which is very frustrating, especially when I want to show you guys my derma rolling progress. Also, I had a question for you guys. So as some of you may know, I have to wait 3 weeks between my 0.75 derma rolling sessions. So I have this 0.25 derma roller. It still hasn't been opened yet. Since I can use a 0.25 every other day, I'm thinking I can squeeze using this all 10 times during those 3 weeks. My question is, what would you guys prefer to see? Me only working on certain areas of the face that I don't use with the 0.75 derma roller, like my forehead, around my eyes, my lips to see if I can plump it up a bit, and my neck, areas I'm not comfortable using the 0.75 size on? Or would you like me to use the 0.25 on my whole face? Let me know in the comments down below. Anywho, on to the video. Hello! So if you've seen my acne journey video, you'll know that I struggled with acne for about 5 years and was able to finally cure it internally by having a healthy state of body and mind. In this video about acne, I'm going to share some external skincare habits that can help you while you figure out your core cause. Disclaimer, I'm not an expert by any means. You don't have to follow these guidelines, but this is what I've learned from my acne journey. Number 1, don't do anything that will agitate your acne. Acne is inflammation of the skin, so you don't want to do anything that will further irritate it. And by agitating, I mean picking at your acne. Using harsh physical exfoliating scrubs, exfoliating too often, rubbing your face with a towel, applying too many serums with active ingredients at once. Instead, try to touch your face as little as possible. Never force a pimple to pop. If you feel like a pimple has formed into a head and is ready to pop, do so with caution. Wrap your fingers with tissue when you squeeze, getting as much blood and pus out as possible. Clean the area with rubbing alcohol, then apply a pimple patch. These will suck the rest of the pus out for you, so if you missed any, you don't have to worry about it turning back into a pimple. Using chemical exfoliators like AHA, for example glycolic acid or mandelic acid, or BHA, also known as salicylic acid. AHAs remove the substance that sticks dead skin cells together on your skin's surface, so it'll help shed dead skin better. BHA helps get rid of dead skin cells and excess sebum deep within your pores. But don't overdo it. Overexfoliating can damage and weaken your skin, causing further irritation and sensitivity. It could even cause stinging when applying certain products. Try exfoliating every 2 to 3 days, if not once a week. Instead of rubbing your skin, try patting your face gently. Try introducing active ingredients slowly into your routine. For example, if you want to lighten your scars, don't throw on vitamin C, alpha-arbutin, niacinamide, retinol all at once. Choose one and stick with it for at least a month and see how it works. If you really want to add more, try switching it up. Use one product one night, then the other the night after, and so on and so forth. Keeping my routine simple worked out the best for me. Change your pillowcase out at least once a week. We don't want bacteria to accumulate and further worsen your acne. Some topical products that can help. As I've mentioned in my acne journey video, most topical products didn't really work for me, but here are the ones that I can recommend. Aztec clay mask mixed with apple cider vinegar and tea tree oil. This is by far my favorite mask. Nothing is as cheap and leaves my face feeling as clean as this. This mask contains 100% natural calcium bentonite clay, which draws out all the impurities deep in your skin. Basically, a vacuum for your pores. It is very strong though, so I'd use it for just spot treating first. Differin gel. Using this to spot treat will dry out your pimple, eventually making it easier to pop when ready. I've noticed that it tends to leave less of a mark after the pimple's gone. It is pretty strong though, so make sure you only use it for spot treating. If you spread it out too much, you might get a lot of dry, flaky skin, so use it with caution. Speaking of fading marks, out of all of the serums I've used, alpha-arbutin was the most effective when it comes to lighting the redness my acne leaves behind, as opposed to vitamin C and niacinamide, which are known to fading scars, so it might work for you. I'm just saying alpha-arbutin worked the best for me. I've already mentioned this, but pimple patches is a real game changer. This is a hydrocolloid band-aid that sucks pus from your pores, which really helps your acne heal faster. Remember though, it'll only work if the pimple is at least partially popped. If the pimple is still sealed, there's not going to be a path for the pimple patch to suck the pus out from. By the way, I have tried Zit Stick It before. Not worth the money in my opinion. And finally, sunscreen. Exposure to the sun will darken your acne scars, so make sure you wear your sunscreen. I always try to avoid the sun, or I just wear a hat. So a quick overview. Be gentle with your acne, change your pillowcase regularly, and try out different topical treatments to see which one works best for you. Well, that's just about everything I could think of. Hopefully it wasn't too overwhelming and was helpful. I was actually given the idea of doing this video after reading this comment. So thank you for inspiring me to make this video. Okay, so I guess that's it for this video. Make sure to let me know what you want me to do with the 0.25 Derma Roller in the comments down below. And with that, I'll see you in my next video. See ya!